Hello, everyone. I'm Alexandra Nancy Kelly. I'm an asthma consultant at Guy's and St Thomas's, and I'm joined by Louise Thompson, an asthma nurse specialist and transition coordinator at Guy's and St Thomas's Hospital. Welcome to today's Ask About Asthma video on transition of care.
Thanks, Andy. So we're really happy to be part of this video today to be able to talk about how we care for adolescents in our service. So Sandy, we were asked to speak today about what makes a good transition clinic. What do you think?
One of the important things of our service, I feel, that we are invited by and joining a fantastic pediatric children's service, where you and I go and meet with the pediatric team and the young patient from the age of about 14 onwards. And we meet with the young adult several times where we get to know all about them, and that's not just about their asthma and their past medical history, but also about their family situation, their career choices, and their social history. And we get to know that patient really well, and they get to know us, and the patient gets to know us, and their parent or carer gets to know us and trust us, I would hope. And together we then decide when the young patient is ready to come and see us in the adult service and make that step, learn how to become independent and look after their asthma and join our service. I would say that joint time together is one of the most important things. What do you think is the most important thing once they've joined us?
Yeah, that's a really interesting question. I think in order to understand this a bit better amongst our cohort of patients, we actually invited our young adults to tell us about their experience of transition, and we used that information to try and improve that aspect of the service. And what we found is that patients really wanted to see the same person. We have quite a large team, 25 odd people, including 5 asthma nurses. So patients really wanted to become familiar with one person in particular. They wanted their appointments to be easily available and flexible. They wanted individualized support during those appointments. And patients also really wanted more information about their asthma. So we found some really key topics: basic asthma education, how to stay healthy with asthma, how to make or change their appointments within the adult service, how to prevent and manage their symptoms. They wanted their concerns about transitioning to be listened to during their appointments. And they wanted more information how their care might differ in the adult service. We really found amongst these patients as well, there was a desire to have information available online. So they wanted resources to be on the internet or via apps. They wanted them to be colourful, have pictures and graphs and videos, which we often found that more traditional kind of adult focused resources didn't quite meet those needs. So we did a lot of searching to find some resources that would be appropriate for those patients. And alongside that, we also introduced a weekly nurse-led adolescent clinic. So that's designed to be a bit of a landing pad for the patient when they reach the adult service. So we're then providing individualised support for most patients up until about the age of 25. So really just highlighting the transition process doesn't end just in the transition clinic. It's important for there to be support also available within the adult clinic as well.
Great. I'm really glad that the young adult and the adolescents, they come and see us for their asthma control, but they have that opportunity to see you in the adolescent clinic each month on a Friday after school. They know how to book the appointment via WhatsApp. And when they come and see you, they whatever the problem is, we try and address it, be that support from our psychologist or support from the physiotherapist. You have a direct line to our pharmacist who has an adherence clinic if we get the feeling that adhering to their inhaler has become a bit of a problem and is not top on their list. So you make appointments for them to see the pharmacist. I'm really glad you're this troubleshooter that is available to them as and when they need it, or via their phone on each week. So I like the fact that we've created an adolescent clinic, which sits independently between the children's service and the adult service, but specifically for our teenagers and young adults. So that's the adolescent service, which I'm very glad we're able to offer, given that this patient cohort often gets forgotten between children and adults, but remains at really high risk of their asthma becoming uncontrolled during these critical years. Lots of ITU admissions happen during the adolescent period, which is catastrophic. And of course, this is a time where they should focus on their career choice or their A-levels and not be held back by their asthma. So this is a critical time, and I couldn't stress enough how important it is to look after adolescents really well. So that's our service. And please, I would invite anyone who has any questions to get in touch with us at Guy's and St Thomas's. We're very happy to share more information and hear how other people look after adults, young adults and adolescents. Thank you very much for listening today.